Congratulations to the 240 undergraduate, 48 master's, and 8 doctoral graduates of the School of Public Health's winter class of 2020. We're celebrating the amazing accomplishments of the next generation of public health leaders. Yet, your mission is only beginning right now. What a time to be entering the world of public health in the midst of the COVID-19 pandemic. Now more than ever, public health is in the forefront. Public health is a bold and noble profession and invisible no more. Perhaps for the first time, your loved ones understand what you've been doing all this time studying public health. They might even know what epidemiology is now. This has been a difficult year. In addition to the coronavirus pandemic, we've been grappling with a pandemic of violence against Black lives, rooted in our country's legacy of institutionalized racism. And we're facing the devastating reality of the climate crisis and its impact on our health and survival. And all three of these together, what some in public health are calling a syndemic, also have a disproportionate impact on people of color and other marginalized communities. Yet, we're inspired by the dedicated work of local and state public health workers, frontline healthcare workers, and all those who are working to safeguard our communities, who keep essential services running and protect the most vulnerable among us. Many of us attended and supported marches, virtual events, and organizations working in support of Black lives this year, some for the first time. Many of us are energized and encouraged that a nationwide plan and the availability of a vaccine will get the coronavirus under control in 2021, and that we'll be able to make progress on climate change, on healthcare, and so much more. We mourn those we have lost this year and must stay vigilant to save lives and to support those who are suffering as a result of a devastating pandemic. We have sadly witnessed the result of what happens when there isn't continued investment in public health infrastructure, and when mistrust of experts and rampant misinformation spread on social media, yes, even by some political leaders, erodes our confidence in the critical work of public health science. Crises like the one we are now in make public health visible to all. Yet we know that the work of public health matters every day, not just in times of emergency. Even in the context of the biggest pandemic in more than 100 years, public health budgets are being slashed and the workforce is shrinking. You are part of Generation Public Health, and you'll play a critical role in making the case to support prevention and public health now and in the future. Every day, lives are being saved by public health, and you are beginning a career path that will protect and improve the health of individuals, the health of families, communities, and populations locally and globally. We need your leadership. We need you to be excellent communicators who can build trust and help people to understand and act on science. This is no small task, but it's a bold and noble one for sure. Pandemics bring public health to the forefront, and we need to keep it there. I'm so proud of our public health terps and the role our alumni and students have been playing all year in preparedness and response activities throughout our region. And I look forward to how you will make your mark in fearlessly promoting health for all in the future. As you celebrate your graduation, please make sure to thank someone who helped get you where you are today. It could be a teacher, a mentor, a parent, or other family member, or a friend. I hope you'll watch our School of Public Health ceremony together with those close to you and celebrate and reflect on all you have learned and are continuing to learn as you embark on the pathway to do public health good. Thank you for being who you are, and congratulations, class of 2020. It's now my pleasure to introduce our commencement speaker here today, Dr. Christopher King. Dr. King earned his PhD in health services from the University of Maryland in 2013 and is currently associate professor and chair of the Department of Health Systems Administration at Georgetown University School of Nursing and Health Studies. He's a former MedStar health executive with a focus on public health and social justice. Dr. King also directs Georgetown's Master of Science in Health Systems Administration program and is an adjunct professor for his alma mater, the Department of Health Policy and Management in the University of Maryland School of Public Health. Dr. King, who joined the Georgetown faculty in 2015, is a fellow of the American College of Healthcare Executives and serves on Washington, D.C.'s Commission on Health Equity. Welcome, Dr. King.
Greetings to the University of Maryland School of Public Health class of 2020. The year was 2013, and I was sitting in your shoes, eager to receive my receipt for what I can say were 6 of the most intellectually stimulating years of my life. And at that time, 2020, it seems so far away. But here we are, and the year has put us to the test. Undoubtedly, this year will be recognized as a turning point in American history. My friends, we have endured so much this year. A contentious political climate is evidence that the nation is deeply divided. Unprecedented wildfires and hurricanes have shown us the ugliness of climate change. The brutal killings of Ahmaud Arbery, Breonna Taylor, George Floyd, and countless others is a reminder that the pulse of racism is thriving in America. And COVID-19, it has illuminated systemic racism as a public health crisis. And this political climate we're in, it's resulted in a blatant attack on the public health profession. While we continue to search for the most constructive ways to navigate all of this darkness, something very special is happening. You are graduating. You know, my 99-year-old grandmother always tells me, she says, Christopher, you know, everything happens for a reason. And that's my message to you. You are graduating from a school of public health at a milestone moment, a point in time that has shown us what goes wrong when science does not drive decision-making in policy, in practice, and in behavior. But as we prepare to usher in a new year, it looks like the tide is turning. And based on my work in the field, there's one thing that I know for sure. The competencies that you have mastered and the degrees that you have so richly earned will be in high demand, more now than ever before. This is your time to boldly show up and advance our shared vision for a brighter future. I personally can't be more excited about your contributions. Let me share just a few examples of what this class will collectively do to move the needle. You'll help us be better prepared for the next pandemic. You'll help us build our local, our national, and our global capacity to address climate change. You'll move us closer to health equity and make significant strides to rectify contemporary manifestations of more than 400 years of racial injustice. I can go on and on foreshadowing your accomplishments, but the bottom line is that the stars have aligned, and they have aligned in your favor. At this very moment, your community needs you, your country needs you, the world needs you. And without a doubt, I know that you are up for the challenge. I know this because I know about the DNA of the School of Public Health alumni community. At our core, we are curious, we're diverse, we're bold, we're fearless. We value health and well-being, and we dream of a just society. And we have been trained by an esteemed best-in-class faculty. We, my friends, are a force to be reckoned with. So on this day, I celebrate you, I congratulate your families and your devoted tribe of supporters who have made this day, well, happen for a reason. Congratulations, class of 2020.
Public health is important to me because it connects us all together regardless of our demographic background. I believe that utilizing the tools that UMD and the School of Public Health have provided me with, all populations would be able to produce a healthier society in which we mitigate the burden of some health issues. I'd like to make a difference in public health by working with underprivileged communities, as well as kids and adults of all ages.
Public health matters because the way we present our data determines how the story is told.
Public health matters because it impacts the life of every being on this earth. There's absolutely no escaping it, no matter how hard we try. We're seeing proof of that now with the current public health climate. We have not only learned in our classes, but have also now personally experienced how public health can impact all aspects of our lives, physically, emotionally, financially, socially, etc. Everyone recognizes this impact. But we, soon to be degree holders in public health, take it a step further. Our duty is not only to recognize that public health matters, but is also to play an active, lifelong role in improving public health. Whether that be by providing health services, researching, generating community programs, and/or educating others, we all have committed ourselves to this role. I myself plan to hopefully provide health services as a physician in the future and educate my patients in the importance of public health. Not only this, but I also plan to use my public health knowledge to help fight against the disparities that exist within the health of minorities. As a female first-generation Hispanic American and first-generation college graduate, this is one of the missions that I have set for myself once I leave UMD. It's a mission I have set for myself because public health does matter.
I will make a difference in public health by being a role model in the Latino community and advocating for justice.
I will make a difference by choosing to be inclusive and continuing to advocate the needs of marginalized communities.
I will make a difference by being a strength and conditioning coach for athletes and military members.
The difference I want to make in the public health field is to ensure underserved communities have access to quality healthcare and a good quality of life. It is apparent more now than ever how much our work as future public health professionals is needed. We must show our world the strength that comes from caring for our communities and standing together as a collective. Our future roles, the ability to commit our work to something larger than us, and serving others is no small task, but it is a beautiful and rewarding privilege. I want to thank the School of Public Health and the Department of Behavioral and Community Health for teaching me invaluable knowledge and skill sets, helping me shape and drive my passion, and opening my eyes to the possibility that we can create impactful change that leads to our world becoming a better place for everyone. I'm excited to continue my journey in the public health field and forever am grateful for the School of Public Health and its faculty for the guidance along my path. Congratulations to everyone graduating today, and good luck on your future endeavors to making the world a better place.
I will make a difference in public health by continuing to learn. Public health is never ending, so always expanding my knowledge on it is important. I specifically would like to improve the accessibility and quality of healthcare through a lens of equity.
Public health matters because equity has not yet been achieved.
I will make a difference by aiming to provide representation and contributing to necessary policies that collectively improve public health. This means working for the underrepresented and minoritized communities to reduce health disparities. I will bring my heart and compassion into the field, and I hope that will be enough to drive positive change.
I will make a difference by becoming a health educator.
I will make a difference by applying knowledge of family science and cultural competence towards a role in coaching. I will strive to mentor the youth with a high degree of awareness and sensitivity towards social behaviors and injustices.
I will make a difference by helping my future patients overcome their greatest obstacles.
now comes the big moment, where by tradition, you officially become graduates of the University of Maryland School of Public Health. This tradition stems over centuries, and it's a simple little maneuver. You move your tassel from right to left, from a candidate to a graduate. So let's do it together. Ready? 3, 2, 1, move! Yay! You're graduates. Way to go, class of 2020.